There's been a surge in COVID-19 cases in 3 provinces. The Free State, the Northern Cape and the North West have all been affected. The National Institute for Communicable Diseases is monitoring the situation. Well, to unpack this for us and give us the latest is the Acting Executive Director from the NICD, Professor Adrian Puren. Prof, good afternoon. Thank you very much for joining us here on the Midday View. Can you just first begin? This surge, how big is it? Has it been over a few days, a few weeks?
So, the last few days, I think we're starting to see increases, and in fact, across many of the provinces, we're starting to slowly see increases. They're not dramatic changes. They're not, if you like, an increase as an obviously predictable resurgence, but the numbers are starting to increase over time, and in particular in the 3 provinces that you have mentioned. And if you look at Northern Cape, for example, it hasn't really come out of its second surge, if you like. It's still there, and the Free State as well has certainly an increase in the numbers as well. So I think it's really just to say that we need to be aware, and that we need to monitor, and that we need to actually continue to adhere to those non-pharmaceutical interventions to really keep this particular numbers in control and in check. But critically, I suppose, it's really to understand where are those numbers coming from? Are they at schools or universities? Are they congregant events? Because we're going to have an increase in mobility, I understand, with regard to school holidays, universities as well. So those particular changes may well also then contribute to what we are actually observing currently.
We've mentioned the 3 provinces, the Free State, Northern Cape and Northwest, but you said there a little bit earlier that elsewhere as well in the country.
Yeah, so we're starting to see, some flickers if you look at other provinces, but not to the same extent. But we certainly are seeing increasing numbers there as well. But I think the provinces that are the ones that you've just mentioned are really the provinces that we really have started to really focus on in terms of keeping an eye on.
Yeah, and you're still trying to work out what's causing the surges there in the Free State, the Northern Cape and the Northwest. Have you got an idea?
So currently that is under investigation, and I'm hoping that we can have more details. So each province, as you know, has its own particular resurgence plans, and in fact its own tracing and tracking and testing plans. So those are really going to be really important to try and understand what are the sources. Are these at particular schools? Are they particular universities or residences that are actually contributing to the numbers that are seen in those particular provinces?
Could we be dealing with cluster outbreaks?
That's correct. That's the technical term, if you like. That's why I say, is the focus going to be at specific events that will allow for these numbers to actually increase? So at schools, for example, or universities, or specific congregant events, for example, that allow for an increase in the numbers and an increase in the transmission.
Yeah, could this be after effect of the Easter period and the school holidays in April?
It may well be, but we've really had a lag. We should have, if there was going to be a marked resurgence, really haven't seen that subsequent to Easter. But it could well be a consequence of some of that. But and as you know, there's going to be an increase in movement again if there are people going on holiday or schools closing, for example. That there may be an increase in mobility, and therefore that could certainly add to what we are currently seeing as well.
Okay, what would your main message be? This afternoon as the NICD to whoever is watching here, and people are thinking about, winter is coming now, and we've heard about the concerns about a possible 3rd wave.
Yeah, it's very difficult for us to really predict when this and if this 3rd wave will take shape or form, but it may well be in these types of events where we're starting to see an increase in numbers and clusters and so forth. So it comes back to the fact that we really need to focus on, the non-pharmaceutical interventions. It's still, unfortunately, those things around wearing masks correctly, physical distancing. If you do not have to travel or move, don't do that. If you don't have to have contact, limit it as much as possible. Events, we're moving into winter, so again, that means we're going to be in closer contact with each other. We also have to consider that this is also the start of possibly the flu season as well. So again, those individuals that are at high risk, I encourage you to get your vaccine. And of course, we really hope that a greater vaccine rollout for COVID-19 will also occur that will really assist us in managing this particular pandemic.
Sounds very sensible. Thank you very much there, Professor Adrian Puren, the Acting Executive Director of the National Institute for Communicable Diseases, or NICD for short.